A remarkable procedure is saving patients from a lifetime of debilitating pain. It's happening right here in Wisconsin.
This is really interesting here. Dannika Lewis introduces us to a young woman who says the surgery gave her a second chance, but you will never believe how doctors did it.
It's been tough. It's been really, really tough.
Since third grade,
It still just came back with vengeance every time.
Stephanie McGuire had a gut feeling. The feeling in her gut wasn't going away.
Honestly, I didn't know a person could be in that much pain.
It went undiagnosed for years, but after countless tests and ER visits,
Not anything they can do for chronic pancreatitis.
or so she thought, until she came home to Wisconsin.
Their world becomes very, very small, and it's basically a bottle of pills.
Home to people like Nancy Radke.
Their day is defined by their next medication dose.
Yes, please open it.
I finally had an answer.
This is TPATE, short for Total Pancreatectomy Auto Islet Transplantation. A mouthful, but UW is one of a handful of hospitals in the country to do it. Dr. Luis Fernandez has performed the procedure about 20 times.
It is art, really, to isolate islet in an efficient way.
Islets produce insulin and other essential enzymes. The 8-hour surgery saves any islets still able to do that.
They went in and first took out the pancreas.
But it's what happens after.
We recovered the pancreas.
He takes it to a lab and puts it in a blender.
Now in a form of almost a milkshake, if you were to call it.
You heard it right, a milkshake, an islet smoothie of sorts, infused back into the patient's body.
Those islets will find its place in the liver. They will find a new home.
I tell them to prepare that the Mack truck hit them, backed up, and ran them over again.
You just feel like someone went into your stomach and took some organs out.
As bad as it was,
And the amount of narcotic that this patient takes are absolutely barbaric.
a few months of recovery was nothing compared to coping with chronic pancreatitis, sometimes without painkillers.
Many of these patients by the medical community are labeled as narcotic seekers and unfortunately mislabeled because the chronicity of the pain is real.
That's probably the most frustrating thing that can happen when you're in that kind of pain.
Now there's no planning around the pain.
That's a day I never thought would come.
Stephanie is back where she belongs, even joining one of her surgeons on the slopes in Colorado.
The truth is that it is magical to see the transformation that these patients have.
A life once filled with nothing but questions is now down to one answer: yes.
I have a whole new second chance now, which is amazing because I didn't think I would ever get that.
Dannika Lewis,
I seriously feel like the luckiest person in the world to be getting a second chance with this.
WISC News 3.
Unreal. Well, pancreatitis brings a high risk of diabetes, and that was a factor in the surgery as well. But Stephanie is making a full and healthy recovery, and she's looking forward to a much more normal life out in Colorado. Unbelievable. An islet smoothie.
Yeah, turning your pancreas into a milkshake. Who knew that would be a good thing?
Wouldn't you be afraid to put it in the blender? You'd say, no, wait.
I'm not.
Yeah.
I'm not going that road.
It's wonderful, though.
All right,
Great.
next it's amazing. Next.